Okay, so this is Jenny Noland. I'm going to perform a physical exam on the same patient. Would you like to use bathroom before we start?
No, thanks.
Okay. All right. So the patient is in a supine position and his knees are bent and his arms on each side. So what I'm going to do is I'm just going to start with observation. What I'm seeing is a pretty long scar at the lower abdomen on the right hand side. And based on the patient's history, he had a appendix removal surgery as a child. I'm also seeing a couple of scars in the middle of the abdomen on both sides because of the 2 hernia surgeries the patient had years ago. And other than that, I am not seeing bruising. I am also not seeing Colon sign or Gray Turner sign. So I'm going to move on to auscultation part. So I'm going to auscultate the bowel sound first in all 4 quadrants by using the diaphragm side of the stethoscope. So I'm going to start with the upper right quadrant. So technically, it should take a whole minute to listen to each quadrant. But here for the recording purpose, I'm just going to shorten the time. The normal sound should be anywhere between 5 and 35 per minute. Okay, everything sounds normal. Okay, so I'm going to move on to auscultate the umbilicus area to listen to venous hums. So what I'm going to do is I'm going to change to the bell side of the stethoscope. And the normal sound, so I'm going to move around the umbilicus area. The normal sound should be this constant humming. Okay, so everything sounds pretty normal. All right, so next I'm going to auscultate 5 other areas to check the arterial bruits, and I'm also going to use the bell side of the stethoscope. So the first area is this abdominal aorta. So I'm going to put the stethoscope at 1 o'clock position around the umbilicus. So the normal sound I'm looking for is this whooshing sound. Okay, so that sounds pretty good. And next I'm going to auscultate the renal arteries. So this is the right one, and then the left one. And I'm going to move to the iliac artery. Okay, so everything sounds pretty good. So the next part would be the percussion part. So first I'm going to percuss all 4 quadrants of the abdomen, starting with the upper right quadrant. So what I'm going to do is I'm going to place the fingers of my right hand, and then I'm going to percuss with my right finger. So I'm looking for dullness, which could indicate the abnormality. This sounds pretty good. Sounds pretty hollow. All right, so next I'm going to percuss on the liver. So what I'm going to do is I'm going to start at the lower right abdomen at the mid clavicular line, and I'm going to slowly move up. See, right now it sounds hollow. And when the sound changes to dullness, that's where the liver margin is. Okay, right here. Could you place your hand right there? Okay, so I'm going to do the same thing from the top to bottom. So I'm tapping in the intercostal space. So what I'm looking for is this hollowness, and then I'm gonna find that spot when it changes to dullness. It's right here. Okay, so I think the whole size of the liver is about 10 to 12 inches long, which is a little bit more on the larger side, but I think it's doing the normal range. Okay, so right now I'm gonna percuss on the spleen to check the size of the spleen. So the spleen is at the last intercostal space and the anterior auxiliary line on the left side of the patient's body. So I'm gonna write here. So it sounds pretty hollow. Could you take a deep breath? Okay, so the sound didn't change, and that's enough. Okay, the sound didn't change, which is a good indication. It indicates there is probably no enlargement of the spleen. So I'm gonna move on to the palpation physical exam. So I'm gonna start to do the light palpation in all 4 quadrants of the abdomen. So what I'm looking for are masses. So I'm doing the light palpation right now. Okay, so I'm gonna do a deep palpation. I'm gonna use both hands now. Press down for a couple of inches. Any discomfort?
No.
Okay, everything feels pretty good. So right now I'm gonna move to the aorta palpation. What I'm looking for is to check the diameter of the aorta. So I'm gonna put the hand here to find the pause. Okay, it's right there. So I'm gonna use the right hand to put it on one side of the aorta artery and then use my left hand to trap the artery. Okay, so the normal size, the normal diameter of the artery is should be 1.5 to 2 centimeters, and that's about the size that I felt, which is good. All right, so right now I'm gonna do the palpation to the liver. I'm gonna start from the lower abdomen on the right hand side and slowly palpate up. So right now this is where the liver is. It looks like a normal size. And I'm gonna just kind of put more pressure and try to push up the liver. And then I'm gonna have the patient to have a big, deep breath. Okay, any pain?
No.
All right, so that's good. That just indicates there is likely no inflammation in the gallbladder. And now I'm gonna palpate the spleen. So what I'm doing is I'm starting from the lower right abdomen, and I'm gonna slowly palpate up towards the upper left abdomen quadrant. Okay, I don't really feel anything, which means there is no spleen enlargement. So the last step, I'm gonna just do the physical exam on the kidneys. So I'm gonna just do the right hand side first. I place my left hand underneath, and the right hand on the top. Really don't feel anything, and then I'm gonna do the same on the other side. Okay, I don't really feel much, which is a good sign. It just means there's likely no abnormality. All right, well, thank you so much. That's the end of the physical exam.